Great. Thank you very much for this great introduction. It's a pleasure to be here. And I come from you, incidentally, from a public health institution with the same acronym as the International Space Station, which I think is a curious coincidence. And I think I'm the first person in this panel talking to you from the perspective of a member state. So I work at national level in Italy. And I'm going to be focusing a little bit more on arboviral diseases. So within the vector-borne diseases, those that are transmitted by arthropod vectors and viruses. So it's looking a little bit more at how our epidemiology is changing. And I'm going to say this as a statement, but also as a disclaimer. I'm just a medical epidemiologist, so I might not be able to answer the difficult questions. But also how we can actually use this information. So I think I totally relate to what was said before in terms of what people like me need are data we can actually take action upon and do something with in terms of public health policies. So just to give you a brief overview of the institute where I work, it was established in 1937. It's a main center for research control and technical scientific advice for Italy, with over, as you can see, 1,000 people, well, actually 1,800 people working there. And basically, we work with the public health authorities trying to create the evidence base for policy. So we're a research institution, but we're also very much public health oriented. And just to give you an idea, that the institute is very large. I come from the first block there, communicable diseases, but you can see there's a lot of people working on health and environment, food safety, animal health, and other disciplines. So moving more into the area where I work, we support the Ministry of Health in coordinating human surveillance of arbovirus diseases in Italy. We provide feedback through our websites, and we collaborate a lot with an institution that has been mentioned many times today, which is the IZS AM, IZS L'Abruzzo del Molise. So they work with us for the entomological surveillance and the animal health surveillance. And it's part, therefore, what I would do is I work within a network that involves them, that involves the people working with transplants, people working with transfusions. And I'm just going to take a couple of minutes to explain this figure for you. This just shows the outbreak of West Nile virus in Italy in 2022, the beginning of it. And what you can see is that in gray, you see where the virus was detected in birds, horses, and mosquitoes, different gradient levels, different shades of gray. And then in color, you can see the human cases depending on the types of symptoms they have. And those that do not have symptoms, so they are asymptomatic, they're the green ones, they're the blood donors, which means that through the surveillance of the animal health, of the medical entomology, we can activate measures to screen the blood and prevent people getting infected with West Nile from transfusions or plants. So this is all very well, we're very happy. We're missing the component of the environment here. We're looking for virus in different living creatures, but we're not looking at Earth observation data. And things are changing in Europe. We have problems with diseases that we previously were just importing from other countries, such as dengue, chikungunya, just to say a couple of mosquito-borne diseases. There, we've seen the first local transmission events. We've seen growing sizes of locally transmitted events within our countries, including Italy. We had a very bad dengue outbreak this year, the worst we ever had, and the highest number of cases in Europe notified as locally transmitted within Europe so far. But also we have trouble with endemic diseases. We have seeing more increased frequency of outbreaks, and we're seeing this south to north progression in Europe. So diseases like West Nile virus are reaching to northern climates, and France had a very bad outbreak this year. So we need to change the way we work. I'm just going to bring you very rapidly a couple of examples of what we're working on now. So one is on West Nile virus. So it's a disease transmitted by the common mosquitoes. Most of the time, most people are affected in rural or peri-urban environments. And what we tried to do was try to see, okay, can we understand through some of those variables, temperature, rainfall, humidity, that when there's going to be an association with an increased number of human cases of the disease. And So what we found, of course, is we didn't find an association except for temperature, and that makes sense. It correlates with what's in literature, and it has a biologic plausibility because temperature impacts on the mosquito, it impacts on the virus, and therefore on the incubation period, intrinsic incubation period, so of the virus within the mosquito. However, what we found is that we have a very strong association, or relevant association, between an increase of 1 degree in average temperature and the 3 weeks including the onset, looking back. So we know that there is an increase in temperature. It's going to relate to an increase in incidence 2 weeks before that case is actually going to be computed into the system. And so our idea is, can we use this for early warning, whether to prevent exposure, considering in humans the incubation period for West Nile is very short, is under a week, on average is about 3 days, or to alert, for example, the transfusion transplants groups. So this is one area where we're looking to work. Now, there's more work to be done. This was just done as a linear. We need to look into windows of climatic suitabilities for mosquitoes. So there's a lot of work to be done. But that's the kind of thing that people like me would be looking for, because then we can start to incorporate them in the way we do surveillance and we do risk communication, in the way we work with our colleagues at different levels. Another thing is looking at Aedes albopictus, that we had several presentations today. Dengue, chikungunya are a concern for us in Italy. We've had local outbreaks of chikungunya in 2007, 2017, and now, as I mentioned, this year we had our largest dengue outbreak with over 80 cases. So quite recently, there's this paper that was published looking at a climate suitability index based on presence, absence, and abundance, and they used as explanatory variables the ones you see here. So annual mean temperature, the annual precipitation, maximum temperature of the warmest month, precipitation of the warmest quarter, and they developed risk maps, basically. And the interesting thing is that they also looked at duration of that risk in time. So we are liaising now with the same group and trying to see, can we do this with our national data that, of course, has a lot of detail at the local level, and can we use this to update our national preparedness plan? Because now we have to start thinking of those diseases not only as something that can come from travel, but as something that can be locally transmitted in an epidemic. And these are just some very preliminary findings, unpublished. So one thing we're finding, first of all, is that the risk is higher for chikungunya than it is for dengue. And where we've seen the outbreaks, which is where the little these areas are highlighted, are not the areas, or not the only areas where there is a risk, and they're not the areas where the highest risk is documented. So it looks like we're seeing incidental location. This is really orienting in terms of how we should plan for this. So this looks like there's a problem quite widely spread across the country with some more relevant hotspots. And the other element, as I was mentioning, is duration. So we're seeing some areas that experience a period of risk which is over 6 months. Some of them are lower than 2. And I think also in that, this can be very helpful for us if we have to give, for example, we have to organize health services, understand, when we should be highlighting our surveillance activities, what kind of messages should we give people so that they're less likely to be exposed. And this is just a tip of an iceberg, and this is my last slide, just to say this is a very exciting time. I think in this past few years, we've seen the gradual, these two worlds, right, of Earth observation and health are getting closer and closer. And this is just the beginning. I think we need to understand more the dynamics of these diseases, for example. What happens in a rural context? What happens in an urban context? What about urban green? That's a whole new thing, right? So what about, of course, we want to have green cities. What does that mean in terms of diseases that are transmitted by mosquitoes that rest in public parks, for example? And we've seen some of that. And so I think this is a great opportunity to be here and to share and exchange, but also to build projects together to understand better the dynamics and translate that into public health practice. So thank you.